Welcome to Weekly Neurology Deep Dive. This show is for educational purposes only and doesn't have any commercial intent.
Good to be here.
Today, we're diving into how to deliver an ALS diagnosis.
That's a good one.
We're looking at an article from the journal Amyotrophic Lateral Sclerosis and Frontotemporal Degeneration.
Oh, okay.
It's called How to Break the News in Amyotrophic Lateral Sclerosis Motor Neuron Disease.
Yeah.
Practical Guidelines from Experts.
Right.
And this deep dive will give a good overview, but you should really read the full article to get the whole picture.
Yeah, good idea.
So,
This is a really, really important topic.
Yeah.
You know, for neurologists,
yeah.
giving an ALS diagnosis isn't just about the medical facts.
Uh-huh.
It's about navigating a really complex emotional landscape for both the patient and
Okay.
ourselves.
And the article really highlights
Yeah.
the emotional weight of that moment for both sides.
Yeah.
It even quotes Dr. Robert Buckman's book, Breaking Bad News,
Oh, yeah, I know that one.
where he says, delivering bad news well can make you unforgettable,
Right.
but delivering it poorly might make you unforgiven.
And that's
That's a pretty powerful.
yeah, it's powerful, and it really underscores the lasting impact
Yeah.
of those conversations.
It is.
What's concerning is that the article also points out that many healthcare providers feel ill-equipped to deliver this news effectively.
And that's despite the importance of this moment.
Right, exactly.
It's interesting how the article emphasizes the healthcare provider's perspective before even getting into the patient's experience.
I think that's deliberate.
Okay.
It acknowledges that for neurologists,
Mm-hmm.
delivering this diagnosis
Yeah.
can be really challenging,
Yeah,
and our own emotions can really influence how the news is received.
that's a good point.
But then the article quickly pivots to the patient's perspective.
Okay.
And it's here where we see some pretty stark statistics.
Oh.
Over half of the ALS MND patients surveyed said they were dissatisfied with how their diagnosis was given.
Over half. That's a significant number.
Yeah.
What were some of the main reasons for this dissatisfaction?
The article highlights three key areas.
Okay.
First, a perceived lack of empathy.
From the clinician.
Right. Second, not enough information provided.
During the diagnosis.
Exactly.
Yeah.
And finally, patients felt they didn't have enough time to ask questions.
So feeling rushed, unheard, and uninformed is a recipe for dissatisfaction.
Especially when dealing with such a life-altering diagnosis.
Exactly.
So-
And this is where the article introduces the ALS-PIKES protocol,
Okay.
which offers a structured approach to help neurologists navigate these conversations.
I like that.
Yeah.
The structured approach is good.
So let's break it down step by step
Yeah.
and see how it can help us improve the way we deliver an ALS diagnosis.
Okay.
The first step is A,
Uh-huh.
for advanced preparation.
Okay.
What does that entail?
Advanced preparation works on two levels, the logistical
Yeah.
and the emotional. On a logistical level, it's about being prepared with the patient's medical history.
So being organized and knowledgeable before stepping into the room
Yeah, having the relevant test results.
and having a clear understanding of the diagnostic criteria
Right,
for ALS.
exactly. What about the emotional preparation?
Okay, that's interesting. What about the emotional preparation? What does that look like?
That's equally important.
Okay.
It's about acknowledging our own feelings
Mhm.
and potential biases about ALS.
So our own baggage.
You could say that,
Right.
this disease forces us to confront mortality,
It does.
and our own comfort level with those topics can really influence how we deliver the news.
That's a really good point.
Mm.
We need to be aware of our own emotional baggage, so to speak, so it doesn't overshadow the patient's experience.
I agree.
All right, on to LS, which stands for location and setting.
Okay.
What's the ideal environment for delivering this kind of news?
The article emphasizes privacy
Okay.
and minimizing interruptions.
Of course.
Choosing a comfortable, quiet space where you can have a focused conversation without distractions.
That seems obvious,
Mm.
but I'm sure it's easily overlooked in a busy clinical setting.
It is.
Okay, so being mindful of the physical space sends a message that this conversation is a priority.
Right.
What about nonverbal cues?
Those are crucial too.
Like,
Maintaining eye contact,
Yeah.
open posture,
Mm,
and minimizing physical barriers like desks or computers.
to create a sense of connection and empathy.
Exactly.
So it's all about fostering an environment of trust and openness right from the start.
Right.
What comes next in the ALS-PIKES protocol?
Next is P for patient's perceptions.
Patient's perceptions.
This step is all about understanding the patient's current knowledge and
Damn it.
emotional state. Before you even dive into the diagnosis,
Okay.
you need to understand what the patient already knows about their symptoms.
So you're saying every patient will come in with a different level of understanding and anxiety.
Some might have done extensive research online
Yeah.
and have a pretty good idea of what's coming.
And others might be totally blindsided.
Exactly. By gauging their perceptions, you can tailor your approach.
So it's about meeting the patient where they are,
Right.
both intellectually and emotionally.
Yeah.
And I imagine this also helps to avoid overwhelming the patient with too much information too soon.
That's right.
And that brings us to the I
Okay.
in ALS PIKES, which stands for invitation.
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 Interesting.
What does that mean?
This step is about explicitly asking for the patient's permission.
Even though they've come in for this specific reason?
It might seem redundant, but it's important.
Okay.
You could say something like, I have some information about your test results. Would you like me to share them with you now?
So giving them a sense of agency and control over the situation?
Exactly.
Okay.
It acknowledges that receiving this news is a big step.
Yeah.
And it allows the patient to decide if they're ready for it in that moment.
So some patients might want all the information right away.
While others might prefer a more gradual approach.
Exactly. It's about respecting their pace.
And their emotional capacity.
That's right. And once you have their permission,
Then you move on to...
you move on to K,
K, okay.
which stands for knowledge.
So this is where you actually deliver the diagnosis and share the relevant information.
This is the heart of the matter.
Yes. What are some key considerations for delivering the news effectively?
The article recommends a step-down approach,
What does that mean?
which means breaking the information into manageable chunks
Okay.
and checking for understanding along the way.
Checking in.
Exactly. Avoid using medical jargon
Oh, of course.
and focus on clear, concise language.
That the patient can easily grasp.
That's right.
So it's about being sensitive to their emotional state and not overwhelming them with too much technical detail.
Exactly. And while it's important to be honest and straightforward about the diagnosis, it's equally important to offer reasons for hope. Hope can be a powerful force, especially in the face of such a challenging diagnosis.
Absolutely.
How do we balance honesty with hope?
It's a delicate balance.
It is.
You might highlight recent advancements in research or talk about the availability of supportive care that can help manage symptoms and improve quality of life.
So it's about acknowledging the reality of the
Yes.
situation,
Right.
while also empowering the patient to focus on what they can control.
You got it. And that brings us to E
Okay.
in ALS PIKES, which stands for emotion empathy.
This feels like one of the most crucial and perhaps most challenging steps
It is.
in the whole process.
It is.
What does it look like in practice?
It's all about acknowledging and validating
It's the patient.
the patient's emotional response.
Okay.
It's about listening attentively.
It's so easy to just focus on the medical facts
So it is.
and the next steps.
Yeah,
But the emotional impact can't be ignored.
it can.
You're right.
Uh,
The patient will likely be experiencing a wide range of emotions.
Absolutely.
Shock, fear,
Sadness,
anger.
anger, and it's our job to create a space where they feel safe to express those emotions without judgment.
That's right.
So how do we respond to those strong emotions in a way that's both supportive and helpful?
Sometimes the most powerful response is simply listening
Just listening.
without
Yes.
trying to fix anything.
Exactly,
Right.
and allowing the patient to process their feelings.
Yeah.
Other times, a gentle touch or a few words of comfort can go a long way.
It's about being present,
Yes,
both physically and emotionally,
absolutely.
and allowing the patient to lead the conversation.
That's right.
And it's okay to acknowledge that you don't have all the answers.
It is. You can say something like,
Yeah.
I can only imagine how difficult this must be for you.
Mhm.
Or, it's okay to feel however you're feeling right now.
It's about being human with the patient
Right.
and acknowledging the shared humanity of this experience.
You got it. And that brings us to the final step in ALS PIKES.
Okay, the final step.
S for strategy and summary.
Strategy and summary. So we're shifting from the emotional
Right.
to a more
Acceptable
practical
approach. Exactly. In this step, you discuss the patient's goals and expectations,
Oh, okay.
outline the next steps in their care, and summarize the key points of the conversation.
And I imagine reassurance is a crucial element here.
Absolutely.
Okay.
Reassure the patient that they're not alone
Mm-hmm.
and that you and your team are committed to supporting them throughout their journey with ALS.
This ALS PIKES protocol seems like a really valuable framework for navigating these conversations.
It is.
But what about the period after the initial diagnosis?
Yeah, that's important too.
How do we continue to support our patients
That's an important question.
as the disease progresses?
And the article actually goes into that as well.
Okay.
It emphasizes that delivering the diagnosis is just the beginning.
The beginning of a long journey.
Yeah. The aftermath period is equally crucial.
Right.
And other healthcare professionals like nurses, therapists, and social workers play a really vital role.
So it's a team effort to make sure the patient feels supported and informed.
Absolutely. The article highlights the importance of addressing the patient's evolving needs as the disease progresses.
Right.
Whether it's managing symptoms, adapting to physical limitations, or making difficult decisions about end-of-life care.
It sounds like the principles of the ALS-PIKES protocol can be applied throughout the course of the disease,
Okay.
not just at the initial diagnosis.
The skills of advanced preparation,
Yeah.
gauging the patient's perceptions, inviting them into the conversation,
Mm-hmm.
providing knowledge with empathy, and strategizing for the future
Are all relevant.
are all relevant
And
at every stage.
at every stage.
Yeah.
This has been a really insightful exploration of the ALS-PIKES protocol
It has.
and its application in delivering an ALS diagnosis.
That's a good one.
Before we move on to part 2, where we'll delve deeper into the aftermath period
Okay.
and the role of the broader care team, is there anything else you'd like to add about the importance of effective communication in this context?
I think it's crucial to remember that while ALS is a challenging diagnosis,
Mm-hmm.
it doesn't define the individual.
Right,
Our role as neurologists is not only to manage the disease,
right.
but also to help our patients live their best lives possible for as long as possible.
Yep.
And that starts with clear, compassionate, and ongoing communication.
Absolutely.
So as we get into talking about the aftermath after an ALS diagnosis, it's important to remember that the initial conversation is just the start of a long and complex journey.
For the patient and their family.
Exactly. The article says that other healthcare professionals besides neurologists are crucial in this journey.
Makes sense.
That's where the idea of a multidisciplinary care team comes in. We're talking about nurses, therapists, social workers, palliative care specialists, and others who each have their own expertise to support the patient.
So it's about moving from that first moment of diagnosis to a more holistic approach.
Exactly. The article specifically talks about how the ALS-PIKES protocol is useful not just for neurologists giving the diagnosis, but for everyone on the care team.
Interesting. I can see how the principles of being prepared, communicating clearly, and showing empathy would be relevant for different kinds of interactions.
For sure. Let's say a patient is meeting with a nutritionist to talk about changing their diet as swallowing gets harder.
Okay.
The nutritionist can use that P for patient perceptions step to understand what the patient already eats, what they like, and what they're worried about before suggesting any changes.
Instead of just giving them a generic diet plan.
Right. They're taking the time to see what the patient needs and make recommendations just for them.
And then there's the I for invitation step, which seems important here too.
It is. The nutritionist can empower the patient by saying, I have some ideas about how we can change your diet to make eating easier. Would you like to hear them?
It's about letting the patient make choices, even with a disease that's taking their control away.
That's a great point. And those same principles apply to physical therapists, occupational therapists, speech therapists, and anyone else working with the patient.
So the ALS-PIKES protocol isn't just a one-time thing. It's a way of communicating that can guide all their interactions throughout the disease.
Right. The article also talks about how important it is to educate and support not just the patient, but their family and caregivers too.
Taking care of someone with ALS can be so hard.
Physically and emotionally.
Absolutely.
Hey.
And the article gives some advice for supporting caregivers.
Right. First, it says it's important for them to have clear and consistent information.
So they're not in the dark.
Exactly. Healthcare providers need to make sure caregivers understand the disease, how it progresses, and what treatments are available.
Like they say, knowledge is power.
It is. Having accurate information can help reduce anxiety and help caregivers make good decisions.
What else does the article recommend?
It also suggests giving caregivers resources for emotional support and respite care.
So they can take a break.
Right. They might want to connect with support groups or counseling services, or even just have someone else take care of their loved one for a bit so they can recharge.
Because you can't take care of someone else if you're not taking care of yourself.
That's it.
Hmm.
And finally, the article says it's important to remind caregivers to take care of themselves.
It's easy to forget about your own needs when you're so focused on someone else.
For sure, caregiver burnout is a real problem.
So reminding them to take breaks, do things they enjoy, and ask for help when they need it is so important.
Absolutely. The article also mentions the role that ALS MND patient organizations play in providing support and resources.
Those can be so helpful for patients and families.
They can.
Yeah.
They offer information, advice, and a sense of community.
They often have chapters that organize support groups, events, and ways to connect with others going through the same thing.
Exactly. The article specifically says that doctors and nurses should tell patients and families about these organizations.
It's a small thing that can make a big difference.
It can. Now, as we talk more about the difficulties of communicating throughout ALS, it strikes me that this disease has some unique communication challenges.
What do you mean?
Well, unlike some conditions where there might be a chance of getting better.
Like remission.
Right. ALS keeps progressing and is eventually fatal.
And that changes how we talk to patients.
It really does. It's tough to balance being honest about what's going to happen with giving people hope.
And there's no easy answer.
No. The article says we need to be open and transparent, be honest about what we don't know, and don't promise things we can't deliver. But at the same time, it's important to remind them that everyone's experience is different.
So while there's a general course for ALS, how it affects each person can vary a lot.
A lot. And we need to focus on making their quality of life the best it can be at every stage.
So even with a tough diagnosis, there's still room for meaning, purpose, and joy.
There is. The article also mentions that sometimes patients get what seems like good news, like normal test results, and it can give them false hope.
How do you handle that?
You have to celebrate those good moments with them, but be careful not to read too much into them or get their hopes up too much.
So acknowledge the good news, but don't downplay the big picture.
Exactly. And remember that hope can look different for everyone, from hoping for new treatments to just finding joy in everyday moments.
As the disease progresses, it becomes more important to talk about tough topics like breathing problems, assistive devices, palliative care, and end-of-life decisions.
Those are never easy conversations.
No, they can be scary for both patients and families.
The article says it's best to start those conversations early and keep coming back to them. Don't wait until there's a crisis.
Be proactive.
Exactly. And when you have those talks, give them the facts, but also be sensitive to how they're feeling and what they want.
It's about giving them the power to make choices about their care.
As the disease progresses.
Exactly.
And it's about supporting them through the whole process. These talks are never easy, but they're important to make sure the patient's wishes are respected and their final days are comfortable and dignified.
The article also says we need to pay attention to the emotional needs of both the patient and their family during these tough conversations.
Of course, ALS affects everyone, and they all need help.
It's a good reminder that we're not just treating a disease, but caring for a person and their loved ones.
Exactly. And the article gives specific tips for helping caregivers who often have a heavy load.
Like what?
It says to give them clear and consistent information about the disease and its progression, provide resources for emotional support and respite care, and encourage them to take care of themselves.
It's all connected.
It is. We have to see caregivers as part of the care team. Their well-being is tied to the patient's well-being.
It sounds like open communication between healthcare providers and caregivers is key.
It is. Everyone needs to be on the same page and work together to provide the best care.
This has been a really helpful look at a complex and difficult topic.
It has. And even though the article focuses on ALS MND, I think the ideas we talked about apply to healthcare in general.
I agree. Communicating clearly and with compassion, focusing on the patient, and always learning and supporting each other are all part of good healthcare, no matter what the diagnosis is.
I couldn't agree more. And I think the ALS-PIKES protocol gives us a useful way to have tough conversations and build strong relationships with patients and their families.
So as we wrap up our look at this article, I want to focus on how we can use these ideas in our work. What are some key things neurologists can start doing in their practice?
One of the biggest takeaways for me is that telling someone they have ALS or having those tough conversations about how the disease is progressing shouldn't be rushed. We have to be thoughtful and compassionate and put the patient's feelings first.
We've been talking about the ALS-PIKES protocol. Can you remind us what each part stands for and how neurologists can use it?
Sure. ALS-PIKES stands for Advanced Preparation, Location, and Setting Patients' Perceptions. Invitation knowledge, emotion, empathy, and strategy, and summary. Each part highlights something important about communicating in a sensitive and effective way when giving difficult news.
And it's not just for that initial diagnosis.
Right? Not at all. That's the great thing about ALS-PIKES. You can use it throughout the whole disease. Whether you're talking about new symptoms, treatment options, or end-of-life care, these principles can help you have better conversations with your patients and make sure they feel heard, understood, and in control.
So it sounds like this protocol can really make a difference for patients.
I think so. And the article says that breaking bad news is a skill you can learn and get better at with practice. The more comfortable we are with these conversations, the better we can support our patients and their families.
The article also mentioned how important it is for the whole healthcare team to work together and communicate well.
hmm
What are some practical ways to do that?
It's really helpful to have regular team meetings where doctors, nurses, therapists, and everyone involved can share information, talk about patient cases, and plan care together.
So everyone's on the same page.
Exactly. It's also important to have clear ways to communicate so everyone knows what's going on.
It's about making the experience smooth and supportive for the patient, with everyone working toward the same goal.
Right. And we have to remember that ALS is a long journey. We need to be ready to offer support and guidance, not just at the beginning, but through every stage.
We've talked a lot about the challenges, but there's still hope even with this diagnosis.
There is. We have to be honest about the realities, but we can also offer hope through supportive care research and the chance to find meaning and purpose even in the face of adversity.
Our job as neurologists isn't just to manage the disease, but to help our patients live their best lives for as long as possible.
I agree. And that starts with communication that's clear, compassionate, and ongoing.
This deep dive has been so insightful. We encourage all our listeners to read the full article, How to Break the News in Amyotrophic Lateral Sclerosis Motor and Neuron Disease, Practical Guidelines from Experts, to learn more about this important topic.
It's a great resource not just for neurologists, but for anyone in healthcare who has to give difficult news.
And as always, this show is for educational purposes only and isn't medical advice. Thanks for joining us for another episode of Weekly Neurology Deep Dive. We'll see you next time for another exploration of the world of neurology.